It's hard to believe we've just ended year 2 of the COVID-19 pandemic. And there's no doubt that we owe everything to all of you who've kept up the fight. You persevered with courage and determination to care for our patients and each other with dignity and compassion. While this has been an incredibly difficult time, in many ways, COVID has pushed us forward.
Nobel Prize-winning physician-scientist Dr. William Kaelin, who spoke here last May, called the COVID-19 pandemic an accelerant, accelerating many developments that would have taken decades to happen, if they happened at all. You know, we agree. So we asked team members who represent each area of our tripartite mission what they thought were the big ideas that have emerged as a result of the COVID-19 pandemic. How did COVID push medicine forward?
With all the challenges that COVID brought, at least the benefit has been that we've increased our use of telemedicine. And even though people might have been a bit hesitant to try telemedicine in the beginning, I think people now really enjoy the fact that they can access their provider from the comfort of their phone. I did a video visit this morning with a gentleman who hadn't been seen in 7 years, and he said to me, I never thought I would be able to talk to my provider from a device I hold in my hand. You can address concerns right away because you have access to telemedicine. So I think that we're turning over a new leaf, and it'll be people taking more control over their health in the future.
We conceived of the Johns Hopkins Post-Acute COVID-19 team, or JHPAC, in the spring of 2020 to provide support for our COVID-19 survivors with mild COVID-19 and those across the spectrum of initial severity of illness.
This is an example of COVID pushing Hopkins forward by uniting the Hopkins community and the different subspecialties to create a truly multidisciplinary clinic that treats patients with chronic conditions.
We had long considered starting a program to support patients who have been critically ill here at Johns Hopkins, and the COVID-19 pandemic really provided us with an opportunity to expedite that process.
I think people are going to see nursing in a whole new light. I think it's always been an admired profession, but I think this has taken it to a higher level. Post-COVID, there is more of an understanding of what a nurse does. You know, I think it's brought it to the limelight. You are truly a hero. You people have gone above and beyond during this crisis to deliver care to very sick patients in a time of a lot of uncertainty.
So how the COVID-19 pandemic impacted research was that it propelled us to really ensure that we had diversity in our clinical trials, particularly for the COVID-19 vaccine. So traditionally, the populations that have been included in clinical trials have been white populations of European descent, primarily male. But when we looked at the COVID-19 pandemic, it was disproportionately killing and hospitalizing Black communities, Hispanic and Latino communities, as well as indigenous communities. So it was really critical that the clinical trials included the populations who were most affected. So now that we understand this, we must continue to diversify clinical trials moving forward, because it's important to understand that different treatments may work differently in different populations, and certain treatments may need to be delivered to certain communities differently than others.
So one of the positives that's come out of COVID is we've really been able to start using patient data from the electronic health record and feed information that we learn from that data back into the hands of frontline clinicians. So for example, if you look here, this is a chart looking at the ratio of someone's oxygen saturation to how much oxygen they're receiving. And you can see here, just using this trajectory of their STEF ratio, these are patients who are going to get discharged. These are patients who go on to get ventilated, and then once they're on the ventilator, the blue line, as people improve, you can clearly see that positive trajectory, and you can also predict who's stuck and who's likely to have a bad outcome. And that information can really help us make care decisions with patients and their families, but it also helps people to kind of get a sense of what to expect during their hospitalization. And we've started partnering through our Precision Medicine Center of Excellence with other centers who are able to share data with us. We can learn more, we can combine data, but we've also had to learn how to standardize data and how to start using common data models so that we can facilitate that collaboration across institutions and even across private and public partnerships.
Initially, early in the pandemic, when we really didn't know much about this disease, we actually had to suspend clinical activities for medical students, which was quite sad. But at the same time, it really stimulated innovation on the part of our faculty to create new ways for our students to learn.
One of the fascinating and more interesting things that happened with us during the COVID time was that more of us were able to join in on our didactics, especially those of us that were either at home or further away from our education building in the ICU setting. We were just able to join with the innovations of Zoom.
It turns out that medical care is very hierarchical under normal circumstances. When our medical students were able to come back to the clinical care environment, I think really they encountered an environment that was very different, where the hierarchies were broken down and people worked much more collaboratively with each other.
We learn, we adapt, and we excel. That's the Johns Hopkins Medicine way. These and many other innovations that have arisen as a result of adversity have clearly strengthened our ability to achieve our mission. But equally important have been those coming from our Office of Well-Being. Their efforts, including expanded wellness programs, have played an invaluable role in helping us all persevere and build our resilience both as individuals and as a team.
We will continue to learn from our experiences and know our journey together will make us better. We are proud of each and every one of you who moves Johns Hopkins Medicine forward. Thank you all.